So, the next case, case number 7. It's a very special case, very special case. It's a case with a tumor in the Pyelo-caliceal system. It's a non-invasive tumor. It's a low-grade tumor, and it's a tumor that was discovered accidentally because here was a stone. And when we practiced the ureteroscopy, of course, we saw the tumor and we prepared for this workshop, special for this workshop. And in this case, we will use the single-use ureteroscope, please, here, the single-use ureteroscope with great performances in tumors. I mean, this ureteroscope from Storz, it's a Storz, it's really unique because, you know, we have a lot of single-use flexible ureteroscopes. In this moment, over 50 models. It's impressive. But this one, this XC1 from Storz, it's unique. Why it's unique? Because the properties of this ureteroscope could define a better intraoperative evaluation of the tumor. This is quite unique, and in the presentation of the case, you will see the performances of this ureteroscope, and of course, we will see why it's so good. And you know, it's in last year, my friend Guido Giusti, great endourologist in Italy, and of course Silvia Proietti, they presented their experience. And you know, in this case of upper urinary tract tumors, we applied many types of lasers. But you know, for this workshop, we choose, I think, the best laser in this situation. The next slide, please. So, if I discuss a little bit about this, these upper urinary tract tumors are not common disease. And the question is, which is the best laser technology for this kind of tumors, I mean for conservative treatment. In the EU guidelines, we don't have any guidance for the best laser technology for the ablation of the tumor in the upper urinary tract. In the AUA guidelines, there is no mention about which laser should be used. Holmium laser, we use a lot this holmium laser because we published some our experience, more than 100 cases in 30 years, so it's not so frequent. Of course, for indication, very important for the indication for conservative treatment. It's a long pulse with 1 joule, 10 hertz, with no contact mode, maybe to reduce trauma to the tissue and bleeding. Thulium laser, thulium YAG laser, you need 10 watts and for the treatment of these tumors, but we will see also because we put also some specific coordinates. We cannot understand very well if there is a tumor left in the necrotic tissues. This is very important. You know, oncologically, it's a problem. Why thulium YAG laser? Because we choose for this case Thulio, I mean thulium YAG laser, because it has a larger coagulation area compared with TFL, also thulium, of course. And the TFL seems to be a good compromise between the excellent hemostasis of the thulium YAG and the tissue cutting ablation of the holmium YAG with an acceptable degree of carbonization. So thulium laser, thulium YAG and TFL has better hemostasis compared with holmium. And TFL, of course, seems to be a very good compromise between the ability of ablation of the holmium YAG and the ability of the hemostasis and coagulation of the thulium YAG. So this is very important in the beginning of the case because we have to precise, the actual experience in the ward, and of course we have to emphasize why we choose for this operation, for this case number 7, the really great Dornier Thulio. So, and also we combine with Tidor and with Elephant 4. Why? Because when you treat a tumor on the wall, pyelic wall, or I don't know, caliceal wall, this could be a problem because the treatment there, the ureteral wall will be very thin. So it's possible the pressure, if the pressure is big, to have a problem. So, and this system, Tidor, it's one of the best now in the world regarding the irrigation, regarding the IRP control, and of course for suction for stones. So now, please present the case.
In this case, we perform surgery at a patient with age 56 with a tumor dimension 1.25 per 0.5 centimeter with localized in the renal pelvis with urine culture negative, cytology negative, and no pelvic wall invasion on CT scan. We use in this case flexible ureteroscopy FLEX XC1 Storz with no 9 French diameter and 3.5 French working channel. Image 1S technology. Access sheath with suction Elephant 2 to 4 from YiGaoMed and ERP control Tidor, Polaris loop ureteral stent Boston Scientific, and Thulio laser system pulse Dornier.
So now we will start the procedure. What I have to say in the beginning is that this ureteroscope is very ergonomic. I mean, is not at all heavy. I feel very good with this one, and and on the other hand, the performances. I mean, you will see the performances of the image will be real impressive. Yes, and endoscopic camera, and now we will go to the pyelic system. Yes, it's good. Let's see. Okay. And now we are here. Okay, good. So now we are in the Pyelo-caliceal system. And you can see we will inspect all the calyxes. And look here, this is the tumor. This is the tumor. Very nice view of the tumor. It's here. It's not big, it's 1 centimeter. It's okay, it's, it's in superior calyx. Perfect. But we have to now to demonstrate the performances of this ureteroscope. So move, please. Change the view. Now you will see this is Clara. Clara, it's better because you can see perfectly the basis of the tumor, and also, look. And now we will move to Clara and Chroma. It's another story. You can see also the microvascularity here and the basis of the tumor. And now we will move to chroma. Chroma is like that, a little bit difference. And now we will move to spectra, spectra 1. Spectra 1, it's, you can see perfectly here, it's black and white, okay? And now we will move to spectra B. Spectra B is also very, very nice to see. The basis of the tumor, and of course, the rest of the calyx. The image is fantastic because this ureteroscope, I mean, this is the single ureteroscope on the market. Now, look to this aspect. It's inflammatory. It's not tumor because now we can see perfectly that move to standard, please. Yes, good. This is standard evaluation. Yes, this is standard, but move now to, I think it's better to go to Clara. Yeah, look, no difference. So it's inflammatory, it's not tumoral. Move to Clara and chroma. Yes, this is better. Look here. There are very clear the vessels, you know, and no aspect, tumoral aspect. And we have to go, I will keep Clara plus chroma. I will keep this one and enter now into the calyx. Look here, the calyx is here. No problem, no tumor here. Maybe here, but it's a little aspect, tumoral aspect. Look, it's quite impressive here. You can see on the right side. Yes, move to normal, I mean to only to see the standard. Look, with standard, it's less. Go to, I like a lot this combination, Clara plus chroma. Look, this is perfect. Now we have to go in the other calyx. It's very good. So we are obliged to see all the calyxes. So look here. This is also superior calyx. No problem, no tumor. Very good. And now look here. This is medium calyx. Also no tumor here. Very clear. And now we will move to the, there are also another 2 calyxes, and also look to the clarity. It's absolutely fantastic. More than 3,000 pixels. It's amazing. It's the best view that I ever saw. This ureteroscope, single use from Storz, XC1. So let's go. This is clear here. And now we will go to inferior calyx. I think, no, this one was because it was composite. Yeah, it's clear. So this is the pyelic aspect, and this is the ureter. So this one we will see later. So now in this moment, we have the pump, and the pressure is very, very good. We can control the pressure, and this is YiGaoMed. It's fantastic technology. Now we have in our hands the possibility to treat a tumor without problems, without the IRP. It's control. Really, really impressive. Look to the image. The image is one of the best of the best. This is the technology of Storz, and this is unique ureteroscope on the market with this technology. Now we will put the laser, okay, and go to the tumor, and I will use, you know, a technique like in bladder. I mean, I will use bloc resection from here. Look, it's so clear from here to here. Did you see? It's really, really very, very, very nice. The case is absolutely wonderful. And yes, it's 1000 microjoules and 10 hertz. Okay. And now we will try to see how it works. Let's see. It's okay. We try here and here. Okay. Good. It works perfectly. Look. Perfectly. Look to the tumor. It's already done. Look. This is the wall, and this is the tumor. And look here. Coming, yes, very close. Yes. Perfect. Look, this is the wall. Very well. Look to the laser. It's perfect. Look here. Look to the wall. Is remain perfect. Remain no tumor. Look here and here, and we move a little bit here and here. Okay. We'll move a little bit. Okay. The wall is absolutely wonderful to see the wall. No perforation. The pressure is under control. Look here. Good. The superior part is completely done. Here it's a little bit on the margin. No problem. This kind of laser, it's absolutely fantastic. And now we'll go into for this part. Yes, we can destroy this part, no problem. I have a little bit here. Okay, good. So now you can see the wall is perfect. Look, no problem. I destroy all the possible zones. Look here. The wall remains clear, clear, clear. And now I will continue. I will continue here with the base of the tumor. Look, it's here. Yes, very careful. Very careful. Here and here. Perfect. And here. Okay. Okay. So the tumor is here. Well, we already realized the unblock resection of the superior part. Why? Because the laser is fantastic. The wall is here with the tumor. Did you see? We are very, very close. Okay. You can see perfectly the tumoral bed. No problem, no tumor here. No restant tumors. It's so clear. So clear. Look here. We are very, very close to finish this operation. Very close. Okay. And here. Okay, let's go here. Yes, this is the inferior part of the tumor. Okay. Good. So, the last part is here. This is the tumor. But what you see now here, it's another tumor. Look here. But this one I can destroy, no problem, because I have the same tumor here, much easier. It's very, very clear here. So there are two different possibilities. One is like this. I think is one of the very rare. I don't know if somebody, look, the tumor is completely detached. This is the tumor. And look to the wall. It's perfect wall. No problem. No pressure. Why? Because it's Tidor. Tidor is with us and help us regarding, you know, the pressure. This is so important. Now I am cleaning all the parts that, you know, maybe could be tumors. And here, look here, and look here. Look, very, very clear. Everything is clear. Look here, and here. Now it's perfect. And here is the base of the tumor. I have also to destroy this part. Okay, no problem. Yeah, look here. It's a very thin tumor. Look here. It's quite impressive. Look, this is another tumor here. Did you see here, this one? Good. Let's see, where is the pedicle? Or not? Okay, let's see. So I need Dornier now, the tumor, and look here how it works. It's okay. I am going to the tumor, and now let's see. Good. Now look to this one. Up. It's okay. Look. The tumor will be out. Will be out. Good. This is combination that I told you of the image. You know, it's important in this kind of tumors. Look, zero bleeding. Zero bleeding. Look to the wall. No perforation. And the tumor was completely resected. Completely resected. And now, what is important? It's important to see the ureter. Because in the beginning of this procedure, we very careful analyzed, you know, and saw, you know, the bladder, because, you know, sometimes it's possible to have, yes, sometimes it's possible to have tumors, and there is it's between 10 and 20 percent could be a tumor in the bladder. So please put the guide. Put the guide. Yes, very good. Fantastic, this Tidor. Looks, this is the system to control the pressure. Yes. Okay, let's see. I can help you. Okay, good. So now I am going to out and to see in the same time. To see in the same time the ureter. I need water. Okay, so to see in the same time the ureter. It's important to control the ureter for possible tumors. Look, it's normal. This is pelvic area. Look to the artery. Wow, it's near us. And here, okay, this is access sheet. It's elephant 4. And now we are going to see all the ureter, all. No tumors, no problems here. Okay. Okay, this is, you know, without stents before. So this is the orifice. It's perfect, very good. So here we have this kind of access sheet. It's elephant 4. This is, after my opinion, this is the best. This is new. This is also new for Europe. For the first time in Europe, it's this access sheet. We can control from here the pressure, plus and minus. Okay, this is the access sheet. We need to control the pressure. It's not possible to really realize such technology without the pressure, to know the pressure. And also, we have this is here to control the pressure, and you can see perfectly it's automatical control. So it's real a dream. And now here is Thulio. Thulio, as I show you, it's I'm sure is the best laser for treatment of upper urinary tract tumors. So we had together three main and new technologies. 3 together. I mean, Storz, single on the market with these capacities, with these performances, the single one in the market, and this is also the single use, is clear. We have this one, we have this one, access sheet, with Tidor, and we have this one. We use 1000 microjoules with 10 hertz. Really the best choose. I mean 10 watts is the power. It's okay. Thank you very much. We will go to the next case in a few minutes.